to the next one here. Patient seems to be slowly conscious here. Hi there. Oh, no, it's okay. Patient arrived. Looks like we're back in the beginning of the week, but it doesn't look like any examination's been done. Oh, yeah, no, shh. Just need to do a quick examination to prep for operation and surgery. Oh, yeah, no, shh. We have a couple neighboring rooms here with patients, so any rise in voice is going to maybe cause a little discomfort. We don't want to do that to our patients and donors, do we? So if we could just keep a quiet voice, we would really appreciate that. Thank you. Okay. Looks to be healthy. Oh, I do apologize. Here, let me take off some of this so we can get a little better acquainted before your examination. Okay. Let's put that down. Alright. Hi there. Put this down for a minute here. No need to be frightened, like I said. It's okay. You're in great hands with us. So, my name is Dr. S. No, that's what you can call me. So, put this back on just for sanitation purposes. I noticed according to our charts, we don't have any information on your medical history, current state, so just to keep a little bit of a barrier between us, okay? Great, so as I was saying, my name is Dr. S. That's what you can refer to me as. No first name and no last name. We like to keep it that way. Yes, and if I am noting your paperwork correctly, you are here for a donor of some sort of organ, is that correct? No, well, that's what they generally say when we ask, but you wouldn't be here if you were not a suitable donor candidate. Don't mind me, I apologize for getting in your space here, but I want to make sure. Yes, okay, that blood looks dried. Nothing fresh, it looks like, okay. Would you mind telling me your date of birth? Don't worry, I can explain everything in due time, and as I said, you are a donor for an organ that we will assess in due time once we evaluate your medical background and your current physical health. You look like a great donor specimen, so we're very excited. Anyway, date of birth, please. Okay, that looks about right. There's no reason you would lie to me, correct? It doesn't matter, honestly. Based on first appearances, you seem like you'd be a great candidate for organ donation, so not too worried. Now, would you mind telling me the gender or sex that you were assigned with at birth? Okay. And would you mind telling me your gender that you identify with now? I don't mean to be intrusive, and if you're not comfortable answering the question, you don't have to. Again, a bunch of factors that go into your candidacy for donation, and we've actually been monitoring you for quite some time, so we're pretty confident that you'll be a great match. Okay. How tall would you say you are? Yeah, okay. And wait. Okay. That's what I thought. I have sort of a sixth sense on heights and weights. Medical thing, I guess. Let's see here. Any medical disorders, diseases, conditions that run on your mother's side? No, great. And any on your father's side? No, great. We already have medical copies of everything, but just want to confirm that there's nothing that any medical records might have missed. Appreciate your cooperation. Okay, let's see. I think that's some... I guess the only other thing, which, judging by the looks of it, doesn't seem like it, but have you previously donated any organs before, or are you currently missing any organs that you're aware of? Oh, shh. It's okay. It's just a simple question. You don't need to fear. So any missing organs that I need to know about? No, okay. Gives us more options, which is great. Again, we have medical records, but it's always good to get first-hand confirmation from the actual donor themselves. I'll put this down for right now. Well, when you're in the black market, so to speak, you have connections everywhere. And a healthy donor like you will be a great specimen to yield nice profit in whatever we market. This donor is all set for preparation, so we're going to do a quick examination and then mark them for surgery. Can you get a room prepped, please? This donor seems very eager to start the procedure, so we won't wait. It shouldn't be more than 10 minutes or so. Thank you. Okay. So, just before I start examining, I want to make it very clear that our code of conduct makes it so we don't kill our donors. So you don't have to worry, your life is in great hands. We just want an organ. We don't want anything more. Just a heart, a spleen, a liver. Oh, no. No, don't worry. We will not be taking any vital organs out of your body. We do, I will say, do sort of a, I don't want to say death with dignity concept with the older donors, but we tend to take healthy older individuals and donors and take the brain, the heart, lungs, more vital, necessary to continue living organs. But no, you're young and you're healthy, and we don't want to take your future away from you. We just want an organ. So it'll most likely be a kidney, something like that, maybe a little bit of liver. We're going to see what we can do here. But I assure you, you're going to wake up and you will be able to live some semblance of a future life. So I'm just going to get a little closer here and just examine different parts here. Okay, so you're right, I don't see any incision marks, any scarring that would indicate that you've previously donated any organs, whether it's willfully or involuntarily. So that's great. Are you by chance left-handed or right-handed? Or I guess, which hand are you more dominant with? Your day-to-day activities. Okay. Just wanted to see if there was a side preference. We're not picky on which side we take the organ from if there's multiple. So whatever's easiest for your recovery. A little bit of dry blood. We've been here for a few days, so it's normal. So we're just going to spray a little bit on the torso area just to make sure, again, nothing's being covered that we need to worry about. Okay? Make sure it works. I'm just going to wipe that a little bit with my finger. Okay, looks like again that's some dry blood that you have there. And it doesn't look like it's covering anything of concern. Again, no scarring, no incisions that have previously been made by anyone, so I'm very confident about this procedure and donation. Oh, don't mind this. We are a little limited in supplies in the underground, so we work with what we have, but don't worry, we have means for sterilizing the best we can. Don't worry, I'm just going to examine a little more here. I'm just going to make a little mark where I'm thinking of doing an incision. We're going to do a little bit of measuring as well, just to make sure we get the proper location of the kidney we're going to take. No, it's okay. Just relax. Remember what I said? We have other donors in the neighboring rooms, so we need to keep it quiet. Okay? I think it should be. Can you come check my work here? I want to make sure I'm accurate. Thank you. Oh, don't mind them. They're just double checking. We like to have a buddy system so things go right. I've had a couple instances of some rogue doctors and volunteers who have either messed up the procedure and properly prepped the donor. Sometimes they've even taken an organ for themselves. We have a profit sharing plan here, so some individuals don't like the sharing aspect, so just want to make sure everyone is being honest in the system, so you could say. Okay. What do you think right there? Okay, make a mark there. Do one more from a different direction. You're being very patient. I appreciate it. Okay. Looks good. Yeah, okay. Thank you. So we have the incision marked. And I'm just going to get some of my materials just prepped a little. We're going to move you to an operating room, but just kind of walking you through. So just so you know, we do have some bottle service, I guess you could say. This has been chilling. Our recon volunteers noticed you were a big tequila drinker, so we thought this might take the edge off. Would you like some? We can get this unwrapped and ready for you. Right, exactly. So we'll get this sent over to your room. What room is this donor going to be in? Donor number 6, 7, A as in apple, P as in Paul. 2? Okay, so if you could bring this tequila to room 2, and so when the operation starts, we can get them a little sedated. Again, we're limited a bit in which supplies we have, so this is a great sedative and antiseptic if needed. So good. Thank you so much. Okay. Alright, so we'll bring that to the room, and then I'm going to show you just kind of what tool we're going to be working with for this specific procedure. Okay, one moment. So grab the tool here. So we're going to be using a very sharp blade to make the incision. This tip is actually very sharp and is good for focusing on making a very precision-based cut. And we have our sharpener, so you get the idea. It's a good way to make sure our tools are sharp, because as you probably know, dull tools are more dangerous than sharp ones. Leads to jagged cuts, imprecision, and even some resistance depending where you're making an incision, which we do not want. We want this to slide through your skin. Slide through your skin. Almost like butter. It causes the least amount of pain for the donor. So you really don't need many more tools than this. If we cut with perfect precision, which based on our measurements and my cross-checking for my colleague there, should be good to go. We will just make a simple incision. Simple incision. Simple incision. And we will simply kind of reach in, grab the kidney, and just sort of cut around it to pull it out. We have some thread and needles to stitch you back up and to cauterize and all the things necessary to stop the bleeding and the recovery and yada yada yada. I will say, as a fair warning to you, that the pain, despite the nerve relaxation aspect of the alcohol, there probably will be enough pain that will cause you to pass out or go unconscious, which is part of the process, and we do it on purpose that way. Because obviously, as I've said, most of our donors don't know they're donating until operation day, so they don't know where they are. They're likely not happy to be unwillingly losing an organ for our benefit. So what we do is, once you slip into that state of unconsciousness, what we're going to do is we will, again, make sure we finish the operation, stitch you up to the best of our ability, and we will leave you in an area nearby. Not nearby where we are now, of course, but nearby to your general area. I don't think you're too far, if I recall. We try to keep it in a 25-mile radius. Makes paying the drivers a little easier, so don't want to have to lose enough wages on that if they're driving, across the state. So we keep our pool within a decent distance. But again, not in any way you're going to find us and track us down. So we'll probably move you somewhere closer to your location, and then we'll leave you there. If you want to seek some additional medical help, it's completely up to you. But at least from our end, we've done what we could do, and we've got our organ, and you've got your life. It's a win-win. Seems a little dull. Have to do a little sharpening before I start on you. Oh yes, I'm going to be the one doing the procedure. Sorry if I didn't make that clear. That's why I'm here. I like to examine my donors so I have a good understanding of their anatomy, kind of where we're making the incision. It's best if the actual surgeon, or I guess doctor on staff, is the one to kind of prep you. So, put this down so I stop waving in your face. You must be terrified enough as it is. But I can assure you, your life is perfectly safe. We will not let any harm come to you. Do you have any questions for me before we get started and move you over to the operating room? Room 2, I believe. No? Okay. I mean, yes, I'm going to ignore the pleas for help and the kind of begging for your life. Again, we're not taking your life. We just want your organs. So, if you don't have any useful questions that I can actually provide some medical knowledge towards, we're going to get you moved to room 2. And we're going to get started on your procedure. Alright, well, I'm going to leave you here for a minute to go sharpen my blade. And one of my associates will be in shortly to move you over to room 2, okay? Alright, well, I will see you in the operating room. Just a few, okay? Alright, see you soon.